All right, so why shouldn't you ask how many hours a surgery is going to take? Yeah, I'm serious about that question, but there's a little modification to it. There's nothing bad in asking how long your surgery will take. However, for the purpose of the people who are going to be waiting outside, your relations who will be waiting outside during surgical procedures, remember that if you are told that surgery is going to take a certain amount of hours, it will most likely take more than that. There's a process of carrying out surgical procedures. So, usually the patient is prepared. You have intravenous access, depending on the hospital, really. If you are in some clinics, uh, many things might have been done before the patient gets to theater. But even then, there are many other things that are done within the operating. So when the patient goes into the operating room, there are still so many things that will still be done. Meanwhile, you will be outside thinking, wow, 1 hour is gone, 2 hours is gone. Usually, and sometimes patient goes into theater 2 hours after we've not even started the procedure because we have to make sure everything is in order. So there's a checklist. It's just like you are flying a plane. If you watched, you would have seen that the pilot and the co-pilot would have gone into the cockpit. They've started their checklist, checking that everything is fine. And then even when you board, it's not immediately you board that the plane takes off. There are a number of things that must be done. It's the same in theater. Even when the patient goes in, they have to check the machines. Once you connect to the machines, they have to check that the patient is well positioned. You may need to characterize the patient. You may need to shade the patient. You need to do some skin preparation. You need to make sure that all the monitors are working before you start the procedure. So sometimes it takes 30 minutes. Sometimes it might take up to 2 hours of the patient being inside the operating suite before surgery actually starts. So you will not start counting down from once the patient goes into the suite. Okay, so when you ask, doctor, how long is it going to take? You should also ask, so how long is the preparation? What's your estimate of the time the preparatory phase will take? Okay, so you can add it. That's one. Number two is sometimes I tell patients it's not all about how long the surgery takes, it's about the safety of the surgery. Okay, so if I tell you surgery is going to take 2 hours and it ends up taking 4 hours, maybe because it was difficult, that is understandable. The key thing here is that the outcomes are good, right? Now, what I also encourage and what I tell people sometimes when surgery is taking longer than expected, I send someone outside to go and allay the fears of the relations. Tell them that relax, things are things are in order. The surgery is taking a longer time than expected, but your patient is fine. If the patient is also not fine, you need to let the relations know things have gone a bit bad, but we are trying to correct it, right? So carrying patients along is very important. You don't just keep operating and just feel, well, they should know we are busy. No, it doesn't work like that. They are worried, and you must sort out their worry. Okay, so I hope I've shed some light to this issue of how long surgery takes. Bye.